Acute myeloid leukemia, the symptoms, diagnosis, and treatments. Acute myeloid leukemia, also called AML, is a rare form of cancer that only represents about 1.2% of all recent cancer cases in the U.S. AML is a rapid disease that is difficult to fight because it attacks blood cells in the immune system, leaving a very small percentage of surviving patients, about 26.6 surviving 5 years with AML. What is acute myeloid leukemia? Acute myeloid leukemia is a cancer of the blood and bone marrow. In the skeletal system, the inside of bones are filled with bone marrow. This soft red tissue produces stem cells that mature into myeloblasts. In a healthy body, myeloblasts develop into 3 healthy mature cells: white blood cells, responsible for fighting infections in the immune system; red blood cells that help move oxygen throughout the body; and platelets that help to stop bleeding by forming clots. This system works to make sure that there are enough of each type of cell developing to keep the body running properly. For a patient with AML, the myeloblasts do not mature into white blood cells, red blood cells, or platelets, but instead become undeveloped abnormal cells. These immature cells begin to build up in the body because of the lack of white blood cells being produced. The immune system cannot fight off this invasion. Therefore, this type of cancer affects the skeletal system, the circulatory system, and the immune system of the body. The body of the affected patient starts to slow down production of healthy blood cells with increased production of abnormal cells. The mutated myeloblasts enter the bloodstream and eventually are taken through the circulatory system. Cancer cells are moved to other organ systems throughout the body and infecting them as well, usually spreading to areas such as the brain, spinal cord, skin, gums, and nervous system of the patient. The symptoms of AML. Most early signs and symptoms associated with AML are not deemed serious enough by the patient to see a physician, since they are likely to be attributed to that of the flu or other non-threatening ailments. Patients that have AML will complain of fever, pale skin, lack of appetite, and frequently be in and out of clinics for mild illnesses. As AML progresses, the patient will start to feel weak and fatigued, experience weight loss, increased bruising of the skin, and observe frequent nose or gum bleeding. These symptoms will usually bring the patient in to see a physician, since they are much more serious than the previous. Diagnosis. Once the patient comes in to see a doctor, they will undergo a physical examination to check for bruising and infection, a blood test to check for abnormal cell counts, and if risk factors are present, the patient will need to supply a bone marrow and spinal fluid sample only if the physician believes that AML has spread to the brain or spinal cord of the patient by observing symptoms such as nausea, vomiting, and visual disturbances. Once the patient has a confirmed diagnosis of AML, there are a few treatment options that are available to them. Cancer treatments come in 2 phases: remission induction therapy, or the initial killing of leukemia cells in the bone marrow, and consolidation therapy, the follow-up of remission induction therapy that kills remaining leukemia cells so that the patient is less likely to relapse. Choices in these phases include chemotherapy, drug therapy, stem cell transplants, and clinical trials. These treatments take time and are very rigorous on the body, so patients are not able to resume daily activities during these treatments. Common side effects after treatment include infection, low blood cell counts, mouth ulcers, hair loss, nausea and fatigue, that can last long after treatment is completed. Depending on the health status and age of diagnosis, as well as the length of treatment, the long-term effects reported have been chronic fatigue, infertility, and secondary cancers. These side effects on the body can greatly decrease the quality of life for a patient while in treatment and after remission. Thank you for watching.